Don't get blinded by the light from fame. We're all ordinary people at the end of the day. We make decisions, some good, some bad, but we all pushing for things we never had.
Ordinary people with extraordinary ways.
Yeah.
Everyday people trying to make a way.
It's just us.
Ordinary people with extraordinary ways.
Yeah.
Trying to make a difference step by step each day. It's just us.
Hi, I'm Charlene. Welcome to the show. So it's travel season, and some of you may be deciding to gas up the car or catch a flight to your favorite travel destination since oil prices are a little bit lower now. But we want to talk today about some potential health risks that you may not be thinking about. Today we'll discuss deep vein thrombosis, or DVT, which is when blood clots can occur in the legs after being confined in small places or either traveling or being immobilized for long periods of time. And to discuss this topic with us today is Dr. Robert Lookstein, who is a professor of radiology and surgery of Mount Sinai. He's going to give us some information about this. You don't want to miss this show. Stay tuned. We'll be right back.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that! Today, women can do anything men can do. And there's one thing we're even better at.
And welcome back. If you're just joining us, on today's show we're discussing deep vein thrombosis, or DVT, and joining me is Dr. Robert Lookstein. Dr. Lookstein, welcome to the show.
Thank you for having me on.
Absolutely. So doctor, with travel season underway, what are some health risks that we should know about that may not be discussed very much or just not well known at all?
Unfortunately, as travel season is picking up, an unfortunate medical diagnosis that's associated with long-distance travel are blood clots, also known as deep vein thrombosis, or DVT. This is when blood cells stick together, typically in the large veins of the leg, and obstruct circulation out of the leg towards the heart. This is the third most common cardiovascular disease in North America and can affect up to 900,000 people in the United States each year.
Wow, those are some staggering numbers.
Absolutely. This is a very common medical condition and can have devastating side effects. One of the most serious side effects is when the blood clots break off and travel upstream towards the heart, occluding the circulation to the lungs. This is referred to as a pulmonary embolism, or a PE. This is a devastating diagnosis. It frequently requires hospitalization, and in the worst circumstances can even be life-threatening. Another side effect, which is, I think, underappreciated by the general population, is a chronic syndrome characterized by leg swelling, heaviness, and inability to walk or exercise. This is referred to as the post-thrombotic syndrome, and it affects the leg where the blood clot is diagnosed. Recent evidence suggests that up to 3/4 of patients who are diagnosed with blood clots can have this syndrome after diagnosis.
So tell us, what are some of the complications and symptoms associated with this condition?
Again, the most common symptoms are pain and swelling in the limb. Unfortunately, if the blood clot does break off and goes to the lungs, the most common symptom is going to be chest pain and difficulty breathing. If any of your viewers think they might have this diagnosis, it's important to see their physician as soon as possible. Early diagnosis of this condition is absolutely critical. Diagnosis can now be done in the office with a simple blood test and with the use of an ultrasound. If a patient is diagnosed, The typical treatment is now medical therapy, typically consisting of blood thinners. And while blood thinners can reduce, if not eliminate, the risk of the blood clot traveling to the lungs, it does not get rid of the blood clot in its entirety. And so patients who do have chronic symptoms of leg swelling and leg pain may benefit from a minimally invasive procedure that can go in and extract the blood clot and restore the normal circulation to the leg. Recent medical advances now allow this procedure to be performed as outpatient or ambulatory surgery, which allows more and more patients to be offered this procedure to resume their normal lifestyle.
Yeah, you know, I just recently went to Chicago, which was a 10 to 12-hour drive for me. And so this information is really helpful for me. But what puts some people more at risk than others for DVT?
So as I mentioned, travel, any period of prolonged immobility, dehydration, an illness, a surgery that requires you to be immobilized for prolonged periods of time. These are all risk factors for developing blood clots. In addition, medications that are hormonally based can place you at greater risk. Smokers are at greater risk. People who are obese, unfortunately, are at greater risk. And then lastly, if there's any family history of blood clots, that would put you at greater risk for developing DVT as well.
So in closing, Dr. Lookstein, what advice would you give to travelers about DVT?
So most importantly, I think it's important to get up and walk around as much as you possibly can. Stay active. If you're on a flight, get up at regular intervals and walk up and down the aisles. If you're in a car, pull over to the side of the road every few hours or so. Pull over at a gas station. Just stretch your legs. Take a walk for a few minutes. Avoid caffeinated beverages. Certainly avoid alcohol. Stay hydrated. Drink water on a regular basis. I can say confidently that if your viewers would like to get more information about this, a fantastic website that was recently developed by Boston Scientific is called clearingtheclot.com. This is a fantastic source of information about what risk factors your viewers might have for developing blood clots and what the best latest recommendations are to reduce your risk of developing this devastating disease.
This is very good information, Dr. Lookstein. Thank you so much for being on the show.
Thank you very much. Again, thank you for having me on, and have a great morning.
And I want to thank you for joining us today. For more information about It's Just Us, please visit our website at itsjustustalkshow.com. All of our links to social media and to email us, all of the information is on the website. Please reach out to us. We look so forward to hearing from you. And until next time, I hope that you will continue to happen to life. Take good care.